Infectious Agents Exposure Reduction Training for First Responders. This training was developed through the Mel and Enid Zuckerman College of Public Health's Environment, Exposure Science, and Risk Assessment Center and the Western Region Public Health Training Center in partnership with the Tucson Fire Department. Through this video, you will be learning protocols and strategies for mitigating your exposure to infectious agents. While the content here and some of the examples will be focused on coronavirus specifically, the information can be applied to other infectious agents as well. Let's first discuss how infectious agents can be transmitted, looking at a highly infectious respiratory virus, like the coronavirus responsible for COVID-19. This virus can be transmitted via multiple pathways: through contact with contaminated surfaces, through inhalation of aerosolized virus due to close proximity to infected patients, and through direct contact with infected patients. In the case of coronaviruses, their survival time is on the order of hours to weeks, depending upon the material type, strain, and temperature. This survival time is common for other pathogens as well. This means that errors in decontamination between calls could lead to the spread of infection from one patient to another. When choosing a disinfectant, make sure the type of disinfectant is appropriate for the pathogen of concern. In the case of coronavirus, ethanol and hydrogen peroxide can reduce concentrations by large amounts. While a 99.999% reduction sounds great, this would mean that if there were 10 million viruses introduced to a surface by an infected patient, that still leaves 100 viral particles. For some highly infectious viruses, it may only take one viral particle to make you sick. This emphasizes the need for consistent and proper disinfection. Here are two examples of disinfectants that could be used. For a full list of products and other types of disinfectants that are effective against coronavirus or other pathogens of interest, check out the EPA's registered list of products. Provided on this slide is a URL for the list of products relevant for COVID-19. While using the same rag or cloth may be convenient if you're using disinfectant from a spray bottle versus wipes, this rag could become contaminated and spread the virus between surfaces. If possible, use paper towels instead when using disinfectant sprays. The learning objectives for this training are to number 1, identify highly infectious pathogen-specific hazards, number 2, understand common exposure pathways for first responders, number 3, compare strategies for reducing exposure potentials, and number 4, distinguish effective infection control protocols. During outbreaks of highly infectious diseases, we should approach the uncertain situation prepared with the right personal protective equipment, or PPE, and protocols to protect ourselves and others from becoming infected. Tier 1 PPE should be used for all basic medical responses. This includes a surgical mask, gloves, and eye protection. For suspected COVID-19 cases or for invasive procedures such as intubation, additional PPE should be worn, including a disposable gown, N95 respirator, and boot covers. Here we see a step-by-step diagram of proper donning technique recommended by the CDC. For Tier 2 PPE donning, the gown is put on first, followed by the respirator. If you are using an N95 respirator, remember to be properly fit tested and to have a clean-shaven face so the mask is securely sealed. The face shield or eye protection is then donned. If boot covers are worn, these should then be donned, followed by the gloves. When putting on gloves, note that the edge of the glove comes up over the edge of the sleeve. This protects the wrist from being exposed to air that may be contaminated and from accidental contact with the skin. Let's take a look at a donning example. Note here that because gloves were put on first, the edge of the gown sleeve came up over the glove. This is not as secure as the glove edge being over the gown sleeve. If the patient is ambulatory, have them leave their room, put on a surgical mask, and move to an open-air area. When caring for a patient who may be infected, limit the number of personnel having patient contact. Keep a 6 to 12 foot distance if possible, as this is recommended to minimize the risk of exposure. For fire departments specifically, it is important to understand that for a stable patient, the entire 4-person crew may not be needed for patient contact. Equipment should be kept as far away from the patient as possible. Do not bring in unnecessary equipment, as this increases the chances that the equipment becomes contaminated. Keep a mental inventory of what needs to be decontaminated after the call. Even surfaces, such as a stethoscope, need to be decontaminated between calls. Notice that the gowns are untied and are dragging on the floor. This may be a challenge with gowns that have short ties. However, floor contact could lead to contamination of the PPE and wherever the ties drag to next. Notice also that equipment such as cords may also touch the floor. Decontaminating these surfaces can limit cross-contamination between calls. Notice that boot covers are being worn. Limiting contact with the floor is one strategy for limiting the unnecessary introduction of pathogens to other environments, such as the ambulance or the station, via shoe movement. When loading the patient, limit contact between the patient and surfaces. A strategy shown here is something we like to call the human burrito. Remember to leave one arm out for taking vitals. If possible, the window between the cab and the cabin should be shut to limit the movement of aerosolized viruses. In a study of how viruses move due to hand contact with surfaces in EMS vehicles, we found that some surfaces are more likely to be contaminated than others. While decontamination of all contact surfaces is important, high-touch surfaces should be a priority. During unloading of the patient, be mindful of contact surfaces as before. Here we see the CDC's recommended order for doffing. If you're wearing boot covers, remove these first with the gloves so as to not contaminate your hands. Then remove gloves, being careful not to touch the outer surfaces of the glove. Remove the gown, rolling it outward and away from yourself. Next, remove the mask or respirator from the back of the head. All items should be disposed of in a biohazard bag. Remember, when dealing with biohazard bags later, use gloves. Finally, wash the hands or use an alcohol-based hand sanitizer. Decontamination of surfaces after a call is an important measure to not only protect future patients, but also to protect yourself from infection. Our exposure models predict that proper disinfection after a call for a coronavirus-infected patient could reduce your infection risk by more than 99.99% for a 15-minute call. When cleaning equipment, remember to be mindful of proper contact times, or the amount of time surfaces are to remain wet with the disinfectant in order for the proper reduction to be achieved. The recommended contact time information can typically be found on the product labeling. Notice here that slight contact was made with the glove during doffing. This highlights the importance of hand washing and use of alcohol-based hand sanitizers after the doffing process. When washing your hands, remember to get spaces between the fingers on the top and bottom of the hands and underneath the fingernails. In order to not contaminate surfaces as they're being decontaminated, one strategy is to start with the highest surfaces and work your way downwards, finishing with decontamination of the floors. Remember to focus on high-touch surfaces. Some of the most forgotten surfaces include radios and personal items such as sunglasses, glasses, or cell phones if used during the call. Remember to disinfect surfaces in the cab as well, such as the steering wheel and keys. Notice that gloves were placed into biohazard waste as opposed to being flung or tossed. This is the way to go. Flinging or tossing gloves can contaminate the floors along the flight path and other nearby surfaces. A common issue at the end of decontamination is how to doff gloves used for decontamination steps and avoid self-contamination by touching the outer handle of the ambulance doors. First, clean the outer door handle. Next, doff the gloves, dispose of the gloves, and close the outer door handle that was just cleaned. Before going back into the station, remove boots and put on slippers. This should especially be done if boot covers were not worn on the call. In order to be effective, approximately 1 to 3 milliliters of hand sanitizer, or enough to cover the front and back of the hands, should be used. It is important to document the type of call, especially when there is a suspected, highly infectious illness, using department standard operating procedures. We hope you found this information helpful for preventing infection during highly infectious disease outbreaks. Thank you for watching our training and stay safe.